Gage Primar here, crushbackpain.com. In the previous video, we discussed the fact that 85 to 90% of people with lower back pain have musculoskeletal mechanical lower back pain. So in this video, we're going to discuss the most common causes of that type of lower back pain. If these videos help you, leave me a thumbs up below, subscribe to the Crush Back Pain YouTube channel. Let's get right into the most common causes of the usual run-of-the-mill musculoskeletal lower back pain. Three structures are usually to blame: the SI joint, the facet joint, and the disc. Before we get into each of those structures and the prevalence that each of those structures is a pain generator, we first need to discuss how the actual pain coming from each of those structures is accurately diagnosed. So most people with lower back pain, they have an X-ray or an MRI or both. X-rays and MRIs do not show pain. Pain is a sensory experience. It's subjective. So while we can take a picture of the spine and we can see the structure with the X-rays, we can see the bones, we can see the joints. With the MRIs, we can see the soft tissue, discs, muscles, nerves, etc. We can't actually see pain. So there's a high rate of false positives with X-ray and MRI findings. You can't always blame structural changes on pain. You can't always blame pain on structural changes. So the only way to truly diagnose SI joint pain, facet joint pain, or disc pain is through either blocks or provocation discography. So you can actually block the nerves that innervate the SI joint and the facet joint. You can actually anesthetize the joints so they're not able to feel pain. These are called diagnostic blocks. So you can do that with the SI joint and the facet joints. If you anesthetize the nerves that innervate the joint, or you anesthetize the joint itself and the person's pain goes away, then the pain's coming from that structure. With the disc, they do what's called a provocation discography, where they actually puncture the disc with a needle to make it hurt. And if that provokes a person's familiar pain, they say, okay, the pain's coming from the disc. Now, there are false positives with these tests, but they are more accurate for diagnosing these specific types of pain compared to X-ray and MRI. That said, these tests aren't normally done unless there's a specific surgical procedure or unless everything else under the sun has been done and they're really trying to dial in what the pain generator is. And oftentimes, to be completely honest with you, these tests aren't even necessary, and that's why they're not done, because most of the time you can figure out what people need to do and people get better and their back pain improves and it eventually goes away. But the numbers that we're going to talk about today are based off of facet joint blocks, SI joint blocks, and provocation discography, not MRI and X-ray findings. But if you look at the literature as a whole, and we're talking about chronic lower back pain here, around 20% of people with chronic lower back pain, the pain is related to the SI joint. Around 36% of people with chronic lower back pain have pain that's related to the facet joint, and around 39% of people with chronic lower back pain have pain that can be blamed on the disc. Okay? So non-specific lower back pain is really not non-specific. We know that usually it's going to be coming from one of those three structures: the SI joint, the facet joint, or the disc. Okay? Now, you don't always have to have these invasive tests to determine the exact pain generator. And it sounds counterintuitive, but it's true. If you look at the medical literature as a whole, if you look at back pain treatment as a whole, it's more important to figure out what types of activities, what types of positions are making back pain worse, modifying, adjusting those positions and activities so they don't make back pain worse, so the tissues are able to heal, and then building up the muscles and building up the spine so those tissues are more resilient and more able to withstand whatever you throw at them so they don't become painful. That's really the key to treating long-standing chronic lower back pain, opposed to always chasing the tissue at fault. I mean, it seems like if you could figure out exactly what tissue is painful and just treat it directly, the pain would just go away. Well, any of you that have been down that road, that's oftentimes not the case. It can be the case, and people do have positive outcomes, but if you look at lower back pain from a broad perspective, and you look at the majority of people that have intermittent and recurrent lower back pain, long-standing lower back pain, they just go through this cycle where they're always chasing the pain. They're always having another test done. They're always having another MRI, another X-ray, another injection, another procedure, and they continue to experience pain. And that's because chasing the tissue at fault is not really the answer. The answer is figuring out why that tissue is painful, addressing that, and then building the tissue up so it doesn't become painful, so it's strong, it's resilient. And that's best done through exercise. The medical literature is very clear. Out of all these different treatment approaches we have for lower back pain, the only one that prevents future recurrences is exercise. So again, this video is more to discuss the prevalence of different structures being the pain generator with normal musculoskeletal mechanical lower back pain. But it's not to say you need to go have any of these procedures done, because even if you determine you have SI joint pain, you have facet joint pain, you have disc pain, even if you determine that, you're still going to need to do the proper conditioning and exercise work to get whatever that structure is back to a point where it can withstand the forces that are put through it daily, the different positions, the different activities that you want to do. That tissue still needs to be able to handle those stresses, those forces, so it doesn't continue to be a pain generator, regardless of if you treat it directly through certain means. So in the next video, we're going to cover X-ray and MRI findings, and we're going to look more closely at how valuable these imaging modalities are and how much weight we should really give them. And then in the video after that, we'll talk more about the common treatment approaches for lower back pain. And that's really going to help you be able to make informed decisions about what types of treatments you should consider, and when you do have certain treatments, what to expect. If these videos help you, leave a thumbs up below, subscribe to the Crush Back Pain YouTube channel, check back weekly for proven methods to beat back pain.